Hey guys, welcome back. My name is Dr. Tyler Forbes. This is Dr. Sean Golden. He's going to be our test pilot today. So what we're going to do in this video is actually show you the style of treatment that we do on the pec muscle. If you watch the previous video on the pec muscle and it being an anchor or the missing link for rotator cuff injuries, you'll understand why we're doing this. If you haven't already seen the first video, I really want you to push pause and I want you to go to the link below and click the link and watch it, because this will make a lot more sense to you. So as we talked about before, these pec muscles, they're really big muscles. We use them a lot, and as a result of that, they become very tight. And oftentimes we don't spend an enormous amount of time trying to loosen them. We do more work concentrically or tightening than we do lengthening. And so what I want to do today is really show you guys what we do and why we do it. And keep in mind, please, the reason why the pec muscle is oftentimes overlooked is very seldom does it come with pain. The pain that you get in your shoulder or in the upper body or neck is very seldom located here, but it's a primary driver of all those other injuries combined. And so the style of treatment that we're going to be doing initially is almost like tenderizing the muscle. It's a big muscle, so we really have to open it up. Most of the time, muscles go from a long position to a short position, long position to a short position, but over time with chronic repetitive injuries, the muscles start to envelop upon themselves and then they become almost like fibrotic. So little bonds form between the muscles, really not allowing it to gain that normal length. And what that will do is really pull your shoulders forward and down. One of the primary reasons why we do this treatment is really, in essence, because we want to eliminate bad posture. We want to eliminate that shoulder motion that's stuck in the forward and down position. So what I'm doing here right now is using the bridge of my forearm and moving Dr. Sean's arm up and back. So why? Well, this would be very similar to like a deep tissue sports therapy massage, and in combination with a stretch. So really, we know that massage is good for us. We know that stretching is good for us. When you do them both together, it's a home run. And so it's really important to get length in there as you work on it. And why do we need to loosen this? I want you to think about when you sleep. Most of us sleep on our sides. What is the position of our shoulders? Internal, forward, and rounded. What about sitting on the computer? The same thing. What about playing on the phone? Now, if our shoulders are forward and round, the humerus is in the wrong position. There's an enormous amount of pressure on the rotator cuff muscles. And then when we do really benign things that we should be able to do every single day, like throw a baseball or a football, the shoulder's not in the right position, so the tendons in the rotator cuff start to rub in a way that they actually physically shouldn't rub. And that creates that tendonitis or tendinosis. So it's really important to make sure that we get as much length in these muscles as we possibly can, to allow those rotator cuff muscles to breathe a bit. Take some tension off those tendons. We don't get another shot. Once those tendons start to break down, it can go into a place or direction that we don't want. We always want to be in a place where conservative management can help treat it. The best anti-inflammatory you can give any body part is motion. So we really want to restore the range of motion. So I go through the entire area of the pec major to loosen it as much as possible to make it nice and soft. Okay, now that I'm done with the pec muscle, the pec major here, manually, I use this machine. Now this machine is very similar. You've seen something similar to this. A lot of people have them, Theraguns. This is sort of the Ferrari of Theraguns. It's a lot more assertive. So we continue to break down that muscle. with this machine to really get as much motion in that pec muscle as we can. And I can already start to feel Dr. Sean's pec starting to loosen up. And what that will enable him to do now is, as it becomes loose, he's going to be able to draw the shoulder back easier. It's going to be much easier for him to maintain a normal neutral posture, because there's not going to be that anchor pulling his shoulder down and forward. And so, regardless of the sport that you do, or if you just sit in front of a computer and have chronic pain, I don't care if it's volleyball, you're going to get a better serve, you're going to get a better block. If it's tennis, you're going to be able to hit the ball better. Golf, swimming, surfing, you name it, shoulder motion is really, really important. If any of you guys are dealing with chronic shoulder pain, you know exactly what I'm talking about. You just want it gone. This is the way to do it. Okay, now we're done with one pec muscle. But there's still one more. Remember, there's two pec muscles, pec major and pec minor. Pec minor is that one that attaches up here and then comes down and attaches on the rib cage. And so when it gets tight, it pulls your shoulder down. So we want to make sure we unbutton it so the shoulder can come back. Okay? So very similar to the pec major. We start with the muscle here, and we, again, put tension on it, and then lengthen. So we do this all throughout the pec muscle. So this will allow you to get your arm completely and fully above your head. A lot of times, one of the biggest ranges of motion that's affected when you have a rotator cuff muscle injury would be something called an impingement syndrome. An impingement syndrome is when the tendons get stuck in this little canal. And the reason why they're getting stuck is, again, because that shoulder is in a forward and down position, so that tendon gets stuck in that little tunnel. And by opening this muscle up, we're able to get that shoulder back. And now the tendons, again, have this opportunity of space. So instead of it being like a straw, it's a big tunnel. So now the tendons are not under that pressure, and then we can reduce, really, in essence, the compressive forces and allow them to breathe and move. And again, remember, lotion is motion. The best anti-inflammatory medication known to man is motion. If you can keep something moving, then the probability of injury or the probability of lack of function or structural integrity becomes really, really under your own control. All right, that's it, guys. His pec muscles are nice and loose now, and as a result of that, his shoulder is able to move a lot more easily, more fluidly. Takes a lot of pressure off those rotator cuff muscles, and that's the first step to freedom. Keep in mind, please, the work we do here is work. We're facilitating that motion. The most important thing that you can do after treatment is make sure that you do all the things that you want to be able to do. The stuff that you do at home is going to be the very thing that makes you feel better. We are not the doctors. You are. You are in control of your own health, your own happiness, your own strength. Do the activities that keep you moving and engaged all the time. Thank you so much. Appreciate you guys watching. I'll check you guys out on another video. Okay? Bye now. Hey guys, thank you so much for watching our last video. Really appreciate it. I hope it gave you some insight into how important that pec is in relation to your rotator cuff injury. And so in our next video, what we're going to do is we're actually going to go through the treatment of the rotator cuff itself. So I don't want you to miss that, because that's what you're here for. And so do me a favor, look at the description below and click on the link, and we're going to go through all of the rotator cuff muscles and show you how we treat them here in the office, so we can get you back to doing all the things that you love, feeling pain-free, feeling loosey-goosey. All right, let's do this. Thanks so much, guys.